I'm Dr. Jonas Apostol. Hi guys, so happy Love Month. This is the month of February, which a lot of us celebrate the Heart's Day. So I have a very interesting case here, a beautiful case. So she sought my expertise. It's because it's not just involving a single crown, it's involving the totality of the face. So she wanted to develop, not just or enhance the appearance of her teeth in relation to her face. So the patient is on her mid 40s and she actually works abroad and she's based there. And her line of work is more on talking to the public and it requires a more pleasant smile. So with her case, there are existing crowns. Like we're talking about porcelain fused to metal crowns that's been there for almost 30 years. So imagine the longevity of the crown. And as you can see here, there's shadowing on the cervical portion of the TFM or the crown itself. So it's pretty obvious and she doesn't like the appearance anymore. And also you can see the lower here, there are diastematas and some of the teeth were covered with direct composite bonding. That's why they were able to close it. But the main concern on that is it actually bleeds a little bit. It's because of the accumulation of plaque on that area. Also, you can notice that the upper left second premolar is buccoverted. So you can see here there are missing teeth, one on the upper and one on the lower. That's the reason why there are some spacing on different teeth. It actually disturbed the alignment as well. Plus, it creates these spacing that would create problem on the occlusion. So with this case, I'm seeing some cavities as well that needs to be treated properly. And the color is a little bit off, especially on the old jacket crowns. It looks like it's super opaque and not a more pleasing appearance. So let's talk about the sizes and shapes of the teeth in relation to the skin tone and everything, and the personality, the age. As you can see here, when the patient smiles, there is like an equal distribution of the width, especially on the central and lateral incisors. So when creating a smile design, you need to make sure that it should be balanced. It should be according to the design principles of not just the smile design but also the dentofacial aesthetic. So diagnostic aids are very very important in every smile design, okay, or every smile transformation cases. So with this case, after getting the x-ray, the clinical assessment, diagnostic cast, pictures, so we found out that there are a lot of issues aside from the main concern like the two crowns and also the diastemata. I've also found out that there are some cavities located on some teeth and also not just the upper but also on the lower. And we need to get rid of those cavities, of course. And smile design is the next step for this after we have accomplished all the diagnostic aids. So with smile design, we have to consider the face. We have to consider the curvature of the lips. We have to consider how big or how wide is a smile. We have to consider also the skin tone, okay? And the age is also number one factor. We have to make sure that we get the right information, okay? Because there will be a lot of changes in the patient's mouth after we place in the permanent. So every single small detail must be taken into consideration when we do this very complicated smile design, because we're not only looking at like few teeth, we are looking at upper and lower teeth. So we have come up with a treatment plan for the patient's case. Number one, for the missing teeth, first is dental implant. and bone augmentation. But since she's not based here, we have to accomplish everything as soon as possible. So bridge is perfect for this case because it's a one missing tooth on the upper and one missing tooth on the lower. So we did a combination of bridge and veneers. And for some big cavities, especially on the lower, we did some crowns and also replacement of the old crowns. So the material we use for this is a layered zirconia. Zirconia core, we layer it with porcelain to make sure that it looks beautiful. So with the teeth preparation, I am using minimally invasive technique. We have to make sure that we only remove what is necessary, like the unsound structure, the extension of the cavity, because we don't want to compromise the health of the teeth just to get the ideal preparation. Okay, sometimes for the veneers, I go for veneer lay. It's because of the extension of the cavity. So it has to be prepared properly. And also, the most importantly is the margin should be very, very clear for the ceramic material. So after getting all the design, we actually get an impression of the design itself, and then I send it to the laboratory. I have my in-house laboratory, so we control everything. I control everything, the design, where to put the stains and where to put the translucency and all. If the patient requested for a like flatter surface, or like we put a serration, we can actually do that like easy as that. It's because of the collaboration with my ceramists. So after finishing in the laboratory, we make sure that everything's clear, everything's perfect, the fit is unquestionable. So we do a try-in. Okay, with a try-in, we can be able to check the shade of the teeth or the shade of the ceramics, the height, if it's like the same with the design that you agreed before we start the procedure. So that is very, very important. And also the fit should be checked. And once everything's set, patient is happy with the design, and I am satisfied also, then we will cement it permanently. So after cementation, the patient is advised to come back to the dental office after a few days for another follow-up. We need to make sure that there's no excess cement, and we take impression for the night guard. Night guard is a must so that it can protect the whole sets of teeth. Okay. So this is a full mouth case, upper and lower. As you can see, the appearance, it looks really natural and beautiful. It's like white but not too white. And as you can see and notice that there's no spacing already. We have addressed everything, especially on the lower. And on the two crowns there, it looks really natural looking. It looks the same as the central incisors and in harmony. The bite is perfect. We actually run it with our T-scan, and it gave us a 50-50 result, because symmetry in dentistry is a must for the health of the TMJ, the teeth, the gums, and the nerves. So one thing I want to focus on is the balance of the smile. Okay, the shade of the ceramics in relation to the skin tone. We can see also the height of the teeth and the characters. It's there in the ceramics, incorporated everything. And also the TMJ, it's perfectly equilibrated, and that is one of the most important aspect in cosmetic dentistry, because everything will fail if there is any parafunctional contacts. Another apostolified smile accomplished. So happy Love Month and enjoy. See you on the next webinar vlog.